Today's health segment is a bit different because we're talking about women and we're celebrating women. And a big part of being a woman is childbirth. There are a lot of people who are always debating whether to go natural or to do the CS. So today we'll be discussing both sides, what are the pros and cons of going natural or going CS. And both are natural, actually. I do have with me Dr. Kelvin Owusu, who is the Medical Director of Optima Care Diagnostics. Good morning.
Good morning.
How are you?
Yeah, I feel like a king, so yeah, surrounded by my elders.
I also have with me Renee Opare-Otoo and Maame Akua Amoah Twum. Good morning, ladies.
Good morning.
How are you both?
Fine, thank you.
Thank you so much for being with us.
Pleasure.
And
thank you.
Happy Women's Day.
Same.
Related.
Yeah.
Doc, let me start with you. Can you walk us through the two different types before we hear the personal stories of Renee and Maame Akua?
Okay, so as you rightly said, there are only two ways for a woman to give birth, either through the normal vaginal delivery, as we call it, spontaneous vaginal delivery, or a Caesarean section. Now, the Caesarean section is where the doctors would intervene and do an operation where they would open the womb, or the uterus, as we call it, and then bring out the baby. Now, there's always been a long-standing debate as to which of these two is better. Now, the question is, are you speaking in terms of the baby or in terms of the woman? Well, when you say, vaginal delivery is better than Caesarean section, what is your reference point? That is it's very important to distinguish what exactly you are referring to. But off the ground, I'll just let everybody understand that once the woman is healthy and the baby is healthy, there's nothing to prevent the delivery process from proceeding normally. Okay. Then there will be no need to do a Caesarean section. Okay. In fact, the only reason why Caesarean sections were introduced was in the event that one of these people, either the mother or the baby, because pregnancy is two people, it's a mother and a baby. Yeah. If any of them was threatened and the Caesarean section would remove the threat, then the doctors would intervene. But we have come to a point in our lives where people are, I should, for lack of a better word, they are abusing Caesarean section. And this is being fueled by a lot of myths and perceptions and all those things, and it's not helping in the long term. So I guess that's why we are here today, to try and find out, how much education we can put out there to see if we can influence the decision-making process. Okay, so we'll be addressing some of the myths, but yes. Before that, Renee, can you please walk us through what your experience was as far as childbirth?
Okay, so I have two kids, and for both of them I had a natural vaginal delivery. Okay. Like he's saying, I didn't have any reason not to do that because I didn't have any issues, no complications whatsoever. But for my first child, I remember I went past the due date, and I think two days afterwards, the doctor was insisting that I should come in to be induced. But I was like, I can still give myself some room to see what will happen next. So I think the very next day, my water broke, and then a labor started some few hours after. And then, I had a normal delivery. But even with that, I was telling him that halfway through, the pain was so severe that I was begging for a CS. By that time, it was too late to do that. Okay. Yes, so subsequently, the next baby was also a natural delivery. But then I'd heard things, some friends of mine had delivered earlier. And I noticed that after the delivery, when people asked them, oh, did you have a natural birth or a CS? And for some who said CS, it's like, oh, what happened? It's like, there's supposed to be some reason why you selected or opted for a CS. So that kind of puts some thoughts in women that if you have a natural birth, it's like, okay, you're a superwoman, you've done well, congratulations. If you have a CS, it's either something went wrong, or you're lazy, or you are not classified as the right or the strong woman. So that kind of puts a lot of thoughts into people's minds. Some people also think that it's not the God-ordained way of having a child. So if you're doing it through a vaginal birth, it means that you're a proper Christian or you're following God's rules and all that. Yeah, so those are some of the things that I had and the challenges,
Okay, Maame, you've done both, right? So walk us through the two.
Okay, so I have 3 kids. Okay. The first one was the natural means, and it was an interesting experience, but unfortunately we developed a complication. And so my daughter developed Erb's palsy. Her hand the nerves got damaged, and so she couldn't move, and we had to do a lot of physio, to get her moving it. And after that, the doctor was like, so for my next 2 babies, the doctor was like, no, we don't want to find out if it's going to repeat itself. What's the point in having that 50-50 chance? It may come, it may not come. So why don't we just, because of that first incident, just go through the CS? And so, as Renee mentioned, naturally I was against it.
Why?
Because from what I heard, my friends and people who had had previous experiences with the CS, they got me to the point where I thought I was doing the unnatural thing, so I won't feel like a complete woman.
Wow.
Yes, and so even at the point where I was being wheeled to the theater, I was in denial. I told my husband.
What were the kinds of things they told you that made you
feel that way? God made it this way, and you are going the other way. And so first of all, you're going against God's way, so it's not right. And then secondly, because you don't push the baby out, you have that connection with the baby, and you're not having the natural means. They're just going to cut you a knife and take your baby out. I was like, just take the baby out, so there's no connection, there's no feel. And then some said the pain after, like 3 days after the surgery, you can. One lady told me, I'll never get my strength back.
Wow.
So with all these information in my head, I was in complete denial until I had it, and I realized that it was the best decision my family and I took.
What was that process like?
Ooh, another interesting process. I was numbed from my legs down, so I didn't feel a thing. Before I realized, I heard my baby cry. Wow. And it's interesting. At that point where I heard my baby cry, it didn't even matter how the baby came out. It didn't even matter to me. I had that connection. What I experienced with the first CS was that I threw up immediately. And so my head jerked, in throwing up, and I developed a severe headache.
Wow.
Yeah.
And so it was very painful. So I was like, maybe that's what my friends were talking about, for like 3 days or 4. And so when I had to go in for the second CS, I wasn't too amused, even though I knew it was life-saving. But for the second time, I had mentioned to my doctor that these were some of the experiences I had. And so we found a way around it. So it was a good experience. Maybe if I had to go the full time, I would choose yes. Maybe.
Dr. Kelvin, walk us through both processes and the pros and cons of choosing to do the pushing the child out or CS, because I think both are natural.
Okay, so let me first of all start from the angle of the God factor, because we hear it all the time. So God made it this way, so that's how it must be. And this has caused so much death, maternal mortality. I mean, it's a big thing in Ghana still. And one of the reasons is sometimes women want to push. So you have a person who's had 2 or 3 previous Caesarean sections who will go and hide in some maternity home and try to push. And that is really a disaster, The thing is, so the normal vaginal delivery is that you have the baby in your womb, it develops up to 40 weeks. And so the first thing is about a 9-month, 10-month. Medically, it's 40 weeks, not 9 months, but that's just an aside. So the baby has grown to 40 weeks and it's time to come out. Usually, by the time the baby is ready to come out, the head should be down. In fact, it's the head going down and pushing against the cervix that will sort of trigger the whole labor process, because the cervix will begin to thin out, and that will send signals that it's time. So then the contractions will begin and they will intensify.
Is that what breaks the water?
Yes, it's actually the contractions and the thinning, because the cervix is closed all through pregnancy. So when the cervix starts opening, then the membranes, we call it, begin to bulge, and eventually as the contractions are increasing in severity, the water will break eventually. And then that would, the idea is that the water will kind of wash the pathway, and then the baby will now be pushed out eventually when the cervix is wide enough. Now that is what we call natural or normal. Now, what if the baby turns to, the head of the baby is not at the bottom? What happens? And so we'd have a breech delivery. It's possible to deliver a breech baby, but it's difficult and much more painful than a normal delivery, because somebody or somebody literally has to turn the baby around. So if the baby's head is up, so the head has to be turned around so that it will not come down. Now, what if the person or the midwife or the doctor is not experienced? What would you do? What if the position of the baby is not even the normal breech that the person is used to? And so a lot of factors come into play. So if you have a breech, and also second, the major thing is, if it's the woman's first delivery, it's much more difficult to do a breech extraction.
Why?
So, because it's not, the pelvis has not been tested. So first of all, as a doctor, you don't even know whether she can deliver the baby in the first place, because the first true test of labor is when you have actually gone through it. So if let's say I had a patient who has delivered 2 or 3 babies before, and then this one is breech, because I know she can actually push the baby out, I am more likely to do a attempt a breech delivery, and if it doesn't work, then we'll go for a surgery. Okay. But if it's a first labor, we don't know. So in these circumstances, I'm going to say that because God said the woman must push, you're going to leave the woman to push. But this same God also made it possible for us to acquire knowledge. And we've learned over time that in such situations, the outcome is not good for the woman and for the baby. And so we must intervene. That's why we go to school and we learn about human anatomy and all those things, so we can intervene. And so we do so to now deliver that baby so that we have a healthy baby and a healthy mother eventually. It does not in any way put any classification on the womanhood or the womanness of that patient. The baby has come out. That's the most important thing. Yes. I mean, there are so many other situations where a Caesarean section will be needed. If the woman has a high blood pressure or blood pressure during pregnancy, even before pregnancy, during pregnancy, it can impact the outcome of that labor. If the woman is diabetic, the baby is big. And I'm sure in your case, maybe your first baby was probably either the baby was big or you were small.
Because it was 3.3, so that's quite normal, isn't it?
3.3, it may be normal. However, it depends on what we call it, your pelvic shape. So in the more, I need to be careful how I put this, but in the places where we have all the facilities available, most women would actually go through a pelvic assessment.
What is that? And by the way, our viewers, if you have any questions about the conversation, let us know with the hashtag Breakfast Daily, and the WhatsApp line is 0550585832. If you're outside Ghana, the country code is +233. Okay.
So say there's been a family history of a big baby. It doesn't have to be you. It could be your mother or a relative, aunties. If there's been a history of a big baby delivered, or there's a history of diabetes in the family, or there's a history of any form of pregnancy-related complication, the woman in question will probably go through a pelvic assessment where they will actually take measurements of the pelvis to make sure that this pelvis is in line. If you take the average, it's a pelvis that can actually, a baby can actually pass through. Okay. So we don't wait until the labor process actually begins. So that's why, for instance, it seems like sometimes, especially in the West, people tend to choose cesarean. They tend to choose cesarean not necessarily because they want to choose cesarean, because probably the assessments have been done and the probability that there will be a difficult labor has been explained to them and they've made a decision. But you see, we on this side would see these decisions being made, and without knowing the background, cesarean, I'm going for cesarean section, or I'm not going for cesarean section. There has to be a background. There has to be a reason why, because as I said in the beginning, if everything is right with the woman and the baby is also fine, a vaginal delivery is
the best.
Is the recommended.
Okay.
If your problem is pain, the pain can be removed. As today, pain can be removed. You don't have to go through pain during the labor process if you wanted to, and of course if you could afford it. But then pain, it should not be a reason why you opt for a cesarean section.
But Renee, let me come to you, Doc. How do you prepare mentally for childbirth and post? Because there are women who have come out to say, right after I had my kid, I was actually depressed. I was not excited to be around the kid. And then everybody else is telling you you're supposed to be happy. How do you psych yourself up for the entire journey?
I don't think you ever be psyched up well enough. Well, for me, I didn't, for the first time, I didn't know what to expect. So right before labor, I went to the labor. I remember I was just sitting down with my mom, we're chatting, taking selfies and all that. And the nurses were looking at us. I know they were thinking that, oh, you'll be crying very soon. And yeah, I was in pain, so much pain.
You started crying.
I was screaming. I'm not a loud person, but I was screaming all over the place. And I was hoping to get some relief, but there was no relief.
Why?
Because I was told I had dilated past the time to have an epidural, so there was nothing I could do about it. I just had to go with the flow. So the baby came out eventually.
Wow.
And my baby was 3.3. And then afterwards, I had a perineal tear too, so I had to heal. There wasn't too much support. I don't know why I didn't think about it. I thought everybody would be around to help, but then suddenly there are times at night the baby is crying, you want to just sleep for just 5 minutes, and you can't get anyone to help because my mom was still working at that time and all that. So I didn't have a nanny to then. So, I mean, yes, and when anybody comes around, if any friend comes around, you can let the person support you a bit, or any close family member who could help would take over for a while. But I think for this, I thought the second one would even be a lot easier, but it was the same. Same. Even though I had a bit of help, it was the same. Yeah.
Maame Akua, how important is it for women to prepare? Because someone will tell you they didn't even know that after the baby breastfeeds, you have to burp the baby, so the baby's just crying, they don't know what's going on. How important is that preparation phase, especially for new mothers?
Yes, I think it's very important. It eases the whole process and, you know, decreases the chance of you being depressed after having your baby. And so I think the birth classes that some of these hospitals do is very important. We need to encourage the ladies to go for these classes because they will get good, accurate information, you know, from qualified people like doctors and nurses to help them through the process. Sometimes it's good to depend on our mothers and, you know, our aunties. But you see, the times are different.
Yeah, because your mom
What works for them will not work for
they have
us.
their own lives too.
You know, but I was saying, you know, when we were leaving the hospital, for instance, they said we shouldn't mold the baby's head. My mother and my grandmother didn't understand because they did that to us and they thought that's why we have beautiful heads and all that. But I think it's really important because when I had my first child, I had all the help. My husband, my mother, and yet I got depressed.
How?
Because everybody's attention was on the baby.
Yeah.
Where did he? Is she asleep? Her clothes. Let me wash it. You know, nobody was like, are you okay? Have you eaten? Until one day I screamed. You know, that why isn't anybody reaching out to me? And when I did, they all, you know, they focused on me a bit. Okay. And I got better.
We have another baby in the house.
Yes, and I got better. So it prepared me mentally also for my second and third child. So I knew what to expect. And I championed myself and I matured myself throughout the process. But the first time, I think we need to go for birth classes to get this first-hand information.
Okay, so we have some messages here. Frank Kojo Asa says, normal push is very difficult, but at the end, it brings some happiness because I remember very well when my wife was at delivery bed and I was standing with her, I realized how special women are on that day. Much love to my wife, Mrs., for giving me a baby girl. How important is it for men to appreciate women before their wives give birth? That's nothing to do with this conversation. And also, can you address some of the myths? People say your vagina never quite gets back to its normal state. Is it true or is it not true? Some people also say that you will leak, so you have Pampers on for weeks. I have not experienced it, but you guys may want to share.
Well, I didn't experience anything like that. I mean, with a perineal tear, you have a bit of pain, discomfort when you're sitting, when you have to use the loo and all that. But if you treat it well, if you're taking I know sometimes they give you suppositories to ease the pain and all that. Within some few weeks, it's healed, and then you're fine.
Back to normal.
Yeah, and then you need to do your pelvic floor exercises as well to tighten the muscle. Because it's a muscle, so you need to.
But can you have sex immediately after, or it's like a process?
But whether you do CS or you do natural delivery, you're not supposed to be having sex.
Oh, you're not? Oh, you know.
at least for 6 weeks, there shouldn't be any activity.
Sex. Okay.
You know, because the womb, whether you have CS or vaginal delivery, the womb is still open. And that's why, so that so-called leak you're talking about, it doesn't matter how the baby came out.
You still experience
because the placenta is kind of like skin. On your bones, it has been ripped off. So there's a sore, literally speaking. There's a sore inside the womb, and that's where the pain comes from. And that sore needs to heal. Yeah. And so until it heals, there's going to be discharge. Because I mean, if you have a sore, there's discharge. That's why you clean it every morning and all that. So that discharge has to come out. So that's the so-called leak. Yeah. You know, so it has got nothing to do with whether it's CS or vaginal birth. So the womb is open for up to 6 weeks, sometimes more. You know, so long as there's a discharge, there shouldn't be any sexual activity. Now, I mean, this is something that you get taught at the birth classes. But you see, unfortunately, most people don't. You see, most people actually don't even attend antenatal. That's the first issue we face as doctors. They don't even come at all. So,
how important is it to attend?
If you don't, it's at attending an antenatal is where you get to attend the birth classes, where they actually take you. I mean, I know it's not as effective as it's supposed to be, but at least almost every government facility where there's a maternity unit has birth classes, but the women don't attend. So that's why there's a lot of misinformation. You know, because even the discharge, there are different colors of discharge. So you start off with bloody discharge, and the blood will clear over time, eventually becomes clear. Yes. And then we'll tell you about this 6-week mark. And so if it's prolonging beyond the 6 weeks, or if there's this change or that change, you need to report. If you don't report, it gets infected. The infection is going to, affect your fallopian tubes. And so we have women who, after delivery, get infection, a pelvic inflammatory disease, which then affects subsequent, so their fertility is affected for subsequent pregnancies. You know, all these things are taught at the birth classes. So in as much as there's understaffing and it's not as effective as it should be, where there's these birth classes, women need to be encouraged to take up, to attend so they can learn some of these things, because some of the complications, like she was saying, once you are prepared for it, even the pain, if somebody actually takes their time to explain to you the reason for the pain and the timing, the frequency, you can tolerate it. Yes, your tolerance is actually boosted. Yes. And some people they may even teach you how to reduce the pain. Like you can actually, there are techniques you can actually use. But you see, if you're already in the pain and I'm now teaching you, but if you are prepared and you practice, so when you watch movies, they actually go with the husband and they are doing the husa.
Yes. Is it true? Is that what happens?
Yes, it happens. It doesn't necessarily happen.
Scratching your husband.
So in Ghana currently, most of the hospitals they don't allow the males to come because it's not private. I mean, there are several women delivering at the same time, so if all the men are, so that's a challenge. But I mean, some other facilities have private rooms where the husbands can go. What I'll say is that if you're a husband and you go with your wife to the labor ward, please stay by the head. Don't get adventurous. Because we have had men faint in the delivery room, and then it causes problems.
Wow.
Because myself, as a medical doctor, the very first time I saw a delivery, I almost passed out.
Why?
It is not easy.
And it's bloody.
I was standing there. I was assisting, and then my leg was shaking. I was like, I was blacking out. I was, what is going on here?
But Doc, you know what? In my case, that's what helped me. My husband saw the points where my baby's head got stuck and she couldn't come, and the maneuver they had to do. So he saw the whole thing. So when the doctor suggested CS for the next delivery, he understood and he was always encouraging me when I was in denial. He was like, Mommy, I saw what happened. It's for the best for you and the baby. Let's get this done. I'm with you, So maybe it's good for them to be there all the time.
We should bring men next week.
Yes,
because supporting your husband, your wife really through the process. Yes. Can we make that happen next week?
We'll try.
Thank you so much, Dr. Kelvin.
Let me just chip in though that for the baby, so the natural process helps because the whole tightness of the space, it forces the fluid that is built up in the chest to actually come out. So babies delivered by normal delivery have fewer respiratory challenges than babies born through CS. So I'm saying this because as a woman, if you have that choice to make about whether to deliver by cesarean or by normal delivery, I'm saying choice because it's not always an emergency. So if there's a choice, if you can choose, I would say go for the natural delivery because the baby also, the baby's health or the baby's situation should be taken into consideration. So if you have to choose the natural and opt for pain relief so that you can have, you can go through the process and as comfortably as possible. The CS might be good for the woman, but it's not necessarily good for the child. So just one statistic: children born through Caesarean section are more likely to be asthmatic. So that's just one statistic to let you understand that the Caesarean section also has complications. And when it comes to pain, I don't know about Maame Akua, but cesarean section causes more pain and you stay in the hospital much longer than the person who delivered through the natural delivery. So if you have a choice, natural birth is a better option than cesarean. But if putting all the factors into consideration, if the cesarean section will reduce the trauma or reduce will solve a particular situation. Let's go. The cesarean section is preferred at that point.
Thank you very much. Dr. Kelvin Owusu is the Medical Director of Optima Care Diagnostics, and of course, Renee Opare-Otoo. Renee, right? I keep Renee Opare-Otoo, as well as Maame Akua Amoah Twum. Both shared their stories with us, and it's important for us to share our stories because there are a lot of young mothers out there who are now about to give birth and they have no idea what to expect. So as the doctor said, you want to take those consultations from your physicians very seriously. you don't want to wait till the day you're giving birth to realize that, you know, I'm not ready for this, because then, you know, it's worse.
We hope you've enjoyed the show. Make sure you subscribe, like, comment, and share with your friends. This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.